let's talk about medications after bariatric surgery. For the first 6 to 8 weeks after bariatric surgery, I want any medications that can be cut or crushed to be cut or crushed. Now, when you're in the hospital, the pharmacist will review your medications and give you a printout of your medications with those instructions on them. Some medications can't be, and so we'll just have you take them whole. And some medications we can stop taking for a few weeks, and so we'll give you that advice as well. But what we're trying to do is not have a bunch of big pills sitting in your small gastric pouch. We will typically give you 5 medications after surgery to help with pain control and nausea and acid control. 4 of those we typically will send in to your pharmacy at your preoperative visit, and then the 5th one we'll send in when you're in the hospital. Those first 4 are gabapentin, which is a capsule. You'll take that twice a day, and it helps with pain control. Now, it's a capsule. It's okay to take as a capsule because it'll dissolve pretty quickly. The second medication is Celebrex. That's also a capsule. You'll also take that twice a day for 5 days, and that helps with pain control as well. So you've got those 2 medications twice a day for 5 days, and that'll cover most of your pain. When you're in the hospital, we'll send in a prescription for liquid oxycodone. That I want you to use if you need it, but if you don't need it, don't use it. It can create constipation, it can create nausea, it can create some other problems. So it's best just not to use it if you don't have to. The other 2 medications that we will have sent in are Zofran, which is a nausea medication. Again, just use that if you need it. If you don't need it, don't use it. And then omeprazole, which is an acid blocker. You'll take that once a day for 3 months. And the purpose is to decrease the acid in your pouch to help with the pouch healing and to prevent ulcers. It also comes in a capsule and can be taken as a whole capsule, but it tends to work better if you actually open it up and there's a bunch of little beads inside, and put those on some yogurt or some pudding or something, and then eat that. So those would be the 5 medications you'll get after surgery. Now, if you're allergic to any of those medications, or if you're already taking one of those medications, we'll just have you take your home medication. But otherwise, you'll get gabapentin and Celebrex for pain, Zofran for nausea, omeprazole to block acid, and then we'll send you home with the oxycodone liquid to help with pain if needed.